Hi, my name is Lacey Schooling, and today I will be demonstrating how to give a piggyback IV medication. So first thing I'm going to do is verify my healthcare provider's orders to my mom. So I have Shirley Cost 5/14/1964 with Dr. Leo, and he has ordered ceftriaxone 1 gram for IV administration, which matches in 250 milliliters of 0.9% sodium chloride, to infuse over 60 minutes. So everything matches for my healthcare provider's orders to my MAR. So I'm going to stay in the medication room and get everything ready to go into the patient's room. So first thing I'm going to do is perform hand hygiene, and then I'm going to grab my medication out of my Pyxis. So I have ceftriaxone 1 gram in 250 milliliters of 0.9% sodium chloride. I'm going to go ahead open my medication. So I have the 250 milliliters of ceftriaxone 1 gram and 0.9% sodium chloride. I'm giving it a squeeze. There's no leaks. It's clear, it's not cloudy, and it is not expired. So I did my first medication check. So I'm going to put on my medications label and my patient's label. So I'm just going to verify that everything's correct. Ceftriaxone 1 gram for IV administration, 1 gram ceftriaxone in 250 milliliters, 0.9% normal chloride. Okay, infuse over 60 minutes. So my medication label matches. I'm going to make sure not to cover up any pertinent information, and I'm just going to verify my patient label real fast. So Shirley Cost 5/14/1964. Perfect. So now that I have this ready, I'm going to take my medication, my secondary tubing, alcohol preps, and my IV label with my MAR and go into my patient's room. So I'm going to knock, perform hand hygiene. Hi Shirley, my name is Lacey. I'm going to be your student nurse today. Can I just have you verify your name and date of birth? Shirley Cost 5/14/1964. And do you have any allergies, Shirley? Codeine and promethazine. Okay, that's what I have. So Shirley, the doctors ordered us to start you with antibiotic ceftriaxone IV. So we're just going to stop your primary infusion that's going right now and start your antibiotics. And then after the hour, when the antibiotics is done running, we'll set your primary infusion back up, okay? Okay, do you have any questions? No? Okay, we're going to get started then. So the first thing I'm going to do is look at Shirley's IV site. So right now the primary tubing is infusing, and there's no signs of infiltration or phlebitis, so it is good to go, and I know that the line is still patent. So what I'm going to do right now is do my next medication check. So I have ceftriaxone 1 gram in 250 milliliters, 0.9% normal chloride. Perfect. So everything matches still. And I'm going to clean the port where I'm going to be starting this medication for 15 to 20 seconds. And while I let that dry, I'm going to get my IV tubing primed. Okay, so the first thing I'm going to do is close this port so I don't spill any of the medication out. And I did my second medication check, so I know I am preparing the correct medication. So I'm just going to spike my bag. Okay, that is spiked. Okay, so since this is medication and I want to give the whole 250 mils, I'm going to prime this very slowly to make sure that I don't waste any. So I'm going to, first things first, fill up my drip chamber about halfway, and then slowly turn. Okay, so the line has been primed, and I know I can just go ahead and attach this since I already cleaned it. Okay, so now my tubing is attached. I can open it. I know it's not going to leak out because it's attached. So I'm going to stop this primary infusion, and then I'm going to line B, piggyback. So I'm just going to do my third medication check out fast. Ceftriaxone, 1 gram, and 250 milliliters, 0.9% sodium chloride to infuse over 60 minutes. So I'm gonna go 250. And I know through dimensional analysis that it's 1 hour. I'm gonna hit therapy, page down. Until I get to my correct medication, ceftriaxone, enter. Okay, and then I can go ahead and start this. So I'm gonna watch my piggyback IV drip chamber is dripping, so I know it's infusing. So now what I'm going to do is stay with the patient for 5 to 15 minutes because I know that if there was an allergic reaction, it would happen quite quickly with this patient. So I'm just going to kind of tidy up her room, make sure she doesn't need anything else, tidy up my stuff, and then make sure to label with the date, the hour, and my initials on this IV tubing. So that way, if she needs another dose, they can use the same tubing for 72 hours. For facility policy, so I'm just going to clean up all my stuff. And then after the 15 minutes, the patient hasn't had a allergic reaction. So she has a colic, she doesn't need anything else. So I'm going to leave, perform hand hygiene, and document the IV site that the primary tubing was infusing when I came in, the medication, the flow rate, the volume, and then I will come back in an hour before the hour is up to make sure that the whole antibiotic is infusing, just so I'm not relying solely on the IV pump. And that is it.